I am so excited. I always especially love when I get you on the phone with another doctor, um, because your brain, it looks like it's on fire, firing on all synapses. Today, we're really talking to an interesting person who's a physician by training, who's not practicing anymore, and has used her experience and her understanding to come up with a diagnostic for some serious sexually transmitted diseases.
Yeah, I really was impressed with just the breadth of the population that she wants to address with the type of testing they're offering. Of course, I feel like as a doctor, my world is pretty narrow, both demographically, but I only take care of women. And she really wants to be able to expand testing for STIs to the masses. So I really found that to be quite refreshing.
And one of the interesting things that said to us, the CEO and founder of Testmate Health, is she really is interested in the universality. So she is trying to create a technology diagnostic platform that men and women and people who identify as non-binary, wherever you are, that the test works for you. So we're really excited to talk to her today.
Let's take a listen. Welcome to the Business of the V. Hello, friends and colleagues. I'm Dr. Alyssa Dweck.
And I'm Rachel Braun Scherl. Each week, we bring you the most fascinating investors, inventors, entrepreneurs, academics, and healthcare practitioners who are making things happen in women's sexual and reproductive health.
If you are a woman, know a woman, have a business, or care about your V health and wellness, fasten your seatbelts and listen in to another informative and inspiring episode.
We are so excited to introduce Siew-Veena Sahi, Dr. Siew-Veena Sahi, CEO and co-founder of Testmate Health. We had the chance to meet in person at JP Morgan, which I would describe as drinking out of a fire hose. And I know many of her investors, but we're just so delighted to have you here. Welcome.
Thank you so much for having me. I'm excited to be a part of Business of the Bee.
Thank you. Well, so we know every story and every company has a backstory. How did you get here? You've done so many interesting different things, and here you are speaking. I do want to say extra thank you because the only time we could find is almost midnight where you are. So thank you so much, but we really want people to hear your story.
No, of course. Well, I am a medical doctor by background. I trained in London. I worked in the NHS, and through that, I had another really amazing opportunity to also do a degree in global public health. And through that, and through my thesis, I ended up researching for a professor who had been commissioned by the WHO to look for a low-cost, accurate test to detect chlamydia and gonorrhea in pregnant women, because the WHO had seen a big spike in complications in pregnant women and newborn babies that were linked to undiagnosed infections. And I think the stat is something crazy, like 70 to 80% of people have no symptoms at all. So they're just finding out when it's too late. And so the WHO really saw need for an easy and accurate test that was low cost, that could be easily deployed so that we could detect these infections early, treat them because they're so treatable with the right dose of antibiotics, and prevent these downstream complications from happening. So I spent about 4 years on this research work stream, and the outcome was that there wasn't a test that kind of met this need. And that's where, I was like, there's a huge unmet need. There's no solution to address this unmet need. And I think this is where like a bit of luck and a bit of fate kind of comes into place, where I was telling my dad about this paper that we're about to publish, and he was telling me about some technology that he discovered from the University of Geneva that was being used to detect bacteria, but in a food supply chain.
Was
That was
he a scientist or a medical doctor as well?
nope. He was a business CEO, and it's funny how these things
Serendipitous.
happen. Yeah, exactly. It's so serendipitous. And I went, hang on a sec, maybe this could work for like, bacterial DNA in healthcare application. And we tried it in the lab and it worked. and I applied for this business plan competition called Mass Challenge. They have a Swiss offshoot here, and I kind of said to myself, okay, I'm going to apply. If I get in, like that's my sign from the universe that I have to give this a shot. And so we were accepted, and then I moved back to Switzerland. I left clinical practice and founded and kicked off operations Testmate in 2021. And it's just been the craziest roller coaster ride since. And our mission is to make access to STI testing easy and affordable for all. And we achieve this with our launch product, which is the first disposable urine test that can detect chlamydia and gonorrhea in all genders and prevent spread.
I'm so curious, and what a great story. I love that. The choice to use urine, was that mostly due to cost or ease of use or all of the above, as opposed to saliva, which I know is popular in some cases, or blood testing, even with just a tiny bit of blood? What was your
Yeah.
thought there?
So for chlamydia and gonorrhea in particular, in women, vaginal swabs are like are typically the sample type of choice.
Yes.
But that's obviously less applicable to men. It's like very invasive. And I think we really felt that if we really want to curb this epidemic of STIs, it doesn't really work to be testing 50% of the population. And so we set ourselves a rather difficult challenge, which is to then figure out how we could work with urine as a sample type. And I think we see there the uniqueness now of our technology, where a lot of people are trying to develop solutions which are based on vaginal swabs. We have developed something really unique in our ability to take urine, which is so variable from different people across different genders, and put it through our disposable sample preparation system and have an output which is an optimized sample quality that allows us to really accurately detect DNA, the presence of DNA and RNA from this bacteria from. But to go back to your original question, the decision is really about the universality of the specimen type, the fact that it's non-invasive.
Yeah.
Also, I think those are really the two key drivers there.
And to that point, because I only see women in my practice, of course,
Mm.
but many of them have male partners.
Yeah.
Is there, I know you said your testing on your website is anonymous.
Yeah.
Is there a way or a thought to also do like partner notification as a result of this? Because you're testing both women and men. And
Absolutely.
of course, I have kids who are young adults, and a while back, remember hearing about these apps that were in college, like, oh my God, I just got a text that someone that I hooked up with had an infection and I better get checked. Never knew how real those things were, but of course they struck panic in lots and lots of young people. So maybe you could just speak to that a bit.
Yeah, absolutely. So exactly, we want to provide the test to treat kind of pathway, and so we've developed a companion app, which is very much just a tool to facilitate connection to a healthcare professional. And what this app allows is for us to take a picture of the test kit, and it's the associated QR code, which is also on the test kit. It provides a digitally verified result. And based on that, we can then connect that user to one of our telehealth partners. So they can have a consultation and a prescription if it's appropriate. And through that app, there can also be an anonymous partner notification, because absolutely another important way for us to prevent spread.
Yeah, for sure. I think one of the real pain points for me as a clinician is
Mm.
having to report these things to the state. So I work in New York, and that's,
Yeah.
the rule. Is there opportunity to make that easier from a physician's standpoint? And I know you've kind of seen both sides of this.
Yeah. So that's a very interesting question, I think, from a regulatory standpoint.
Mhm.
And I think once we get FDA authorization for an OTC authorization, or over-the-counter authorization, actually the burden for reporting is no longer on us as a company or on the
Okay.
consumer. And we've seen a precedent in this, in that there is an over-the-counter HIV test that has been approved. And there is no burden on
Right.
on the consumer to have to report their infection. I think here the CDC really recognizes the increasing public health burden that these infections have, and I think wherever we can identify tools and support tools to promote diagnosis and prevention, it's
Treatment.
yeah, exactly, and treatment is being very encouraged.
So share with us, if you will, where you are from a commercialization perspective. You talked about down the road going for OTC classification. Where are you now? How would someone access this, and who's using it?
Yeah. Well, I wish I could say we're on the we were already on the market, but we are a pre-FDA company. We're still in development. We're right now at what we call the feasibility prototype stage. So we have an integrated device that can be manufactured at low cost at high scale, and it meets the usability requirements for getting an OTC authorization. And what lies ahead of us is the final design, setting up our pilot manufacturing so that we can start producing for our clinical trials and therefore FDA authorization. So we hope to be in the market end 2027.
And so what have you done to date from a testing perspective to validate this model that you're talking about? It's not new, obviously, to use urine as diagnosis, but
Yeah.
it sounds like the way you're approaching this is different. And
Yeah.
so what are you doing right now as you're building the company? And I'm assuming raising money, as so many of the ventures that we speak to are, to determine what the path forward is. Obviously, there are a lot of things that the FDA requires, but there are a lot of steps you could do before then.
Yeah. So in terms of validation, we kind of at this stage look at it in two ways. So we have like the analytical validation, to determine the performance of the test. And so we do this kind of at every stage of prototype development. So I think in the alpha, so the earliest prototype phase, I think we just crunched the numbers yesterday. We did between 2,000 to 2,500, tests of the very early kind of lab assays and lab prototypes. And then the phase we are now, we've tested, I think, nearly 550 prototypes. And within
Wow.
that, yeah, within that, we ran a validation study according to the FDA protocols to basically determine how our test performs against the gold standard lab machines. And so we were excited that the data showed that we had equivalence to the gold standard lab machines, but obviously in a low cost disposable format. So that's kind of the analytical validation, which was really
Right.
cool to get that data. And then the second form of validation is really around usability. I feel that sometimes, and I also feel that sometimes when we're speaking to some of the more technical investors, that usability is like a nice to have. But actually, for a product like this, it's an absolutely key kind of design.
Explain to listeners what that means, because
Yeah.
it does mean something slightly different in this context.
Yeah, I think, we we have to assume that people using our test have never, have no science background, have no technical background. And, we need to demonstrate to the FDA that 95% of people can look at our tests, and the first time they perform our test, they can perform it correctly and interpret the result correctly.
There's nothing specific about your test, but for people who think the FDA is just this big amorphous thing, it's like it's actually
Yeah.
made up of people who want to
Yeah.
make sure that when a consumer is using something at home, you've eliminated most of the risk of them using it improperly and causing any harm. I
Sure.
remember when I was raising money for the first time for a product that was applied to the outer lips of the vulva, and you had a reaction in 7 to 10 minutes. And I was in an investor meeting, and the investor takes it out and puts it on his hands and starts rubbing it in and says, "I don't feel anything." And I said, "That's not where it's supposed to be applied." You hear these stories, it's on the burden is on the company. For instance, if you're making a product that's meant to be applied vaginally and someone puts it in their eye,
Exactly.
they're unclear that the company has some liability. So when you think about this, I know for people who haven't been involved in any regulatory aspects of businesses, as all of us have, there's a lot that happens. There really is a great effort to protect
Huge.
consumers.
I am told fifth grade level instructions, number one. Number
Yeah.
two, the stories could fill an entire book about whether a pregnancy test is positive or not. And they
Yeah.
have gone to such lengths to have plus signs or
Yeah.
words, you are pregnant
Yeah.
in the
Yeah.
positive channel. But I do have to say, I think we can really thank the pandemic for one thing,
Yes.
which is that people are so much more comfortable
Absolutely.
with self-testing and the whole mission there,
Yeah.
which is why I asked about urine because it seems so
Yeah.
easy, and
Yeah.
swabbing not so much. And
Yeah.
men definitely don't want to swab themselves, so I'll leave it at that. Okay, so here's today's hot flash. Chlamydia is one of the most common bacterial causes of STIs in the US. The CDC estimates approximately 4 million people in the US develop new chlamydia infections each year, and nearly two-thirds occur in young people age 15 to 24.
Who is your primary target? I know the universality is one of the big benefits. Is there a particular age group or demographic? And the reason I ask that is people are always stunned to hear, at least in the US, that the STI rate is growing the most rapidly in the 50 plus community.
Yeah.
And there are a whole bunch of reasons for that. We often think of STIs, in younger people where maybe you have multiple partners and aren't necessarily using protection that would prevent the transmission. So who do you see first at the center of your target?
So, despite the fact that our test is designed for the consumer at home as the end user, our business model is actually a B2B. Our go to market is B2B. And so we want to work with and sell into channels that have an existing relationship with our end user. And those end users are exactly high risk population. So that includes MSM, so the men who have sex with men community, people who are HIV plus, people who are on PrEP, university and college students. And we might throw in the 50 plus there too, seeing as they're becoming an increasingly relevant target for us.
Oh, they
But
absolutely are. Think about it. The 50 plus are reticent to use condoms because they don't need pregnancy protection necessarily.
yeah,
And many men after a certain age find
yeah.
condoms to be difficult to use. So, yes, absolutely all of the above.
But it's really interesting actually because when we went out to kind of speak to the different demographics, like what's so interesting about sexual health is that your perception of it is so dependent on your socioeconomic factors, where you grew up, and your age. And so the value proposition of our product completely changes depending on who you speak to. Like for college students, it's like, oh, we want something easy, fast. We don't want to go to the doctor. Like that's going to waste so much time. But then if you go to like 50 plus, for them it's ooh, the stigma of being seen in a waiting room or going to my physician and seeing the doctor that I see for regularly for other conditions and having to ask for an STI test. Like there's a lot of stigma that they perceive still. And so it is interesting for sure. But I do think the way we would market it to the different demographics, varies very much.
Do you have other infections or aspirations in terms of what's in your pipeline? Because obviously these are three of the most common infections, but actually the burden of disease is so much on infections that are not considered sexually transmitted, but certainly sexually related. Any thought of that type of testing, or is that not really your market?
No, 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 no. We've designed the product to be a true platform. And so the hardware never changes, but the chemistry inside the hardware will change according to the disease that we're targeting. So because urine and the urine sample preparation is really our competitive advantage. So the intention is to try and maximize what we can in urine first. And so in the pipeline, we have urinary tract infections. So today, the best improvement to kind of fast testing of UTIs is this little dipstick that changes colors. The little squares change
Mhm.
color. I'm sure you're well familiar
Oh, yes.
with it. But it doesn't really give us a good idea of what exactly is in the urine. And we typically still need to send the sample off to the lab for culture. And so I think the ability to be able to differentiate between the bacterial strains to guide antibiotic prescription
Mhm.
at home or in a point of care setting is something that we find very interesting and could really be a real game changer considering the burden of UTIs on women.
And the
Um,
call to action, is that to have your related practitioners manage this stuff, or to, just give a heads up and send them off to their own doctors? Because, we lose so many people to follow up.
yeah.
I just wonder how that would go forward.
For the UTIs or for the
No,
STIs?
for the STIs.
Yeah. So we see ourselves as kind of bridging the gap between the lab testing that is happening today versus the guidelines for testing that the public health authorities are calling for. So, for example, someone who's sexually active should be getting tested
Yeah.
between, 2 to 3 times a year, but they're actually only getting tested once a year or once every 2 years. So the intention is to leverage that encounter that they have with their healthcare professional to get the full lab panel and send them home with a test or two, and get them to do it in between appointments, knowing that they can always come back if the test is positive.
Okay.
Alyssa, I'm curious, in your office, we use these big numbers about percentage of disease. Talk a little bit about the actual burden of these conditions being undiagnosed. What happens, the scenario when someone comes to you, they're concerned they have symptoms or they don't, you do a
Yeah.
test versus they've been suffering for a while, they don't know what the cause is, and then they come to you with a full-blown infection.
Yeah. Well, I have to go back to, one thing that you've already said, Siew-Veena, which is that it's all demographically related and related
Mm,
to lifestyle. So in my community, in my practice, the burden of STI is probably lower and more, admired compared to some other areas where the burden is much higher. With
mm,
that said, I have a very compliant population. The standard of care is for anybody 25 or younger to have gonorrhea and chlamydia testing, whether they ask for it or not. It
mm,
typically gets done on a pap smear, or it gets done as a standalone test, either
mm,
via swab or via urine. Luckily, the positive results in my neck of the woods are few and far between, but nonetheless, to your point, Rachel, yes, it's the 50-plus-year-olds, maybe, who are living in retirement communities and, living their best selves, if you will, who are
mm.
coming in for a lot of testing and treatment. Um, my question is always, never to leave the doctor out of the loop.
Yeah.
So would these, and you said this is mostly a B2B, but would this be something that people would do at home and then bring to their own doctor, or leave their doctor out and mostly go through your maybe telehealth providers or providers on your site with education?
So they have the option to do either. And I think what we found from speaking to our core target is that sometimes people don't want to go to their regular doctor for their STI
Correct.
healthcare. And so I think our objective, is to maximize prevention. And so if we can provide them options that makes them feel more comfortable to get tested and treatment,
More
then
likely to do that, yeah.
Yeah.
yeah, then I think we're likely to do that. We just want to remove the barriers that are
Yes.
associated with it. And I think even if you are, very open-minded, you don't perceive necessarily the stigma like day to day of STIs, at some level, I think people do feel a bit embarrassed, like speaking to someone
Oh,
they've known a really long time about getting STIs.
yeah.
But I wanted to come back to a point that you made, Alyssa, about the community that you work in and not seeing a very high prevalence of STIs. And I think that's such an interesting point because I think we also really see that the burden of STIs is
Yes.
very disproportionate depending on the demographic. And I think, the state of Washington published a study that kind of showed that people with HIV were nearly 40 times
Yeah.
more likely to get gonorrhea. And I think if you were Black American or African born, you were
Yep.
6.7 times more likely. So I think really when it comes to STIs, there's a real question of health equity and access that becomes
Yeah.
really
Yeah.
important.
And I think the people in their 20s and in college right now, they didn't grow up in a world where, certainly Alyssa and I did, where people were dying from
Yeah.
AIDS. And there became a long period of time where everybody was testing. It was just what you did to be responsible.
Yeah.
Now that you can live,
Mhm.
that anyone's trying to get AIDS,
Yeah.
but now that you can live with it, it's a different it's a really different conversation. And you see generationally, how some generations are worried about pregnancy prevention, others then are more worried about disease prevention, and we'll see where we wind up now. But to Alyssa's point, COVID certainly taught us how to, swab our noses and read whether there was one or two lines to figure it out,
Yeah.
which I
Yeah.
think is a benefit for your
Yeah.
company, because the hardest thing
Yeah.
is teaching people to do new things.
Oh,
I had one question about the telehealth. Are you,
yeah.
is that going to be under your purview? Are you
No.
building relationships with other companies or building your own telehealth company?
No, our intention is to kind of stick to what we're good at, which is making low cost, easy to use tests and partner with, well-established telehealth partners. I think there have been really amazing companies that have come on to the scene, which are really focused on providing sexual and reproductive health care. And we would partner with them.
So I have a personal question that I hope is okay, but do you miss clinical medicine at all? And I will tell you why I asked this. I obviously was doing some research before speaking to you and
Yeah,
noticed that you had made a comment to a previous interviewer
yeah.
about doctors being treated like pawns.
Oh,
And
yeah.
that really struck a nerve because I get
Yeah,
that.
yeah,
And I just wonder if you miss it and now that you've quote unquote gone to the dark side of business.
Ah!
yeah. Oh, it's such a good question. And it's honestly, I reflect on that quite a lot because from age 14, I worked towards becoming a doctor. And then I felt like I became a doctor and then I left clinical practice. I think I loved the job, but the challenge is that when you're in the UK, you have only one employer, which is the National Health Service. And I did not have the most positive experience. I did not feel supported by my employer. And I feel like even today, junior doctors are put in situations that is not fair on them and being forced to make clinical decisions, which, they shouldn't be making because of the infrastructure in the system. And so that's the part that I don't miss. I miss working with I miss working with patients a lot, and I miss the work, and I miss the science and the people aspect of it. I do really miss that, but I think being able to implement change on a population level, like that really drives
Yeah.
me. And if I'm able to do that with Testmate, then I feel like it makes the crossover to the dark side more palatable.
I mean that with all love and kindness, of course.
No, I
Many
know.
of us are on the dark side, but
Yeah.
I always like to ask that question because it has a personal meaning to me, and I get it. You trained so long, but you are doing good on a whole higher level. So really, really great.
We want to thank you so much, Siew-Veena, for being on Business of the V today. We will continue to watch you. We are very big cheerleaders for entrepreneurs building in this space who are really trying to solve hard problems. And for people who want to learn more, there's a little bit of a wait until this product is available. But for people who want to learn more and understand a little bit more about the platform or urine as a testing approach, where can they find more information about you?
Yeah, they can reach out to me directly on my email, which is siew-veena@testmatehealth.com, or they can connect with me on LinkedIn or go on our website, which is www.testmatehealth.com.
Thank you
Fabulous.
so much. Terrific.
Thank
Have a
you.
great
Best of
weekend, and
luck.
thank you for staying up so late for us.
Thank you. Thank you so much for having me. It was nice to chat.
Don't forget, subscribe to our podcast at businessofthev.com for the latest trends and trendsetters in women's health and business.